Dr. Anthony Fauci says, quote, help is on the way. That after some very positive good news on a possible coronavirus vaccine. But for most of us, that help is months down the road, In the meantime, we are staring at a very bleak here and now in the fight against the coronavirus. You see the red and the orange. The red is the worst. The orange is bad. Red means 50% or more new infections today compared to last week. Orange means infections are up between 10 and 50% now compared to last week. And you see here 44 of the 50 states trending in the wrong direction right now, 44. 6 holding steady, which tells you zero states on the right trend line right now when it comes to the coronavirus. And when you look at this, it is simply depressing. This almost don't need the numbers straight up, but the numbers make it even more numbing. Now above 120,000 cases on a daily basis. That seems to be the regular now. Remember, back in the summer peak, it was around 60,000. The first wave was below 30,000. Right now, 120,000 cases and counting. You see one day above 140,000. That is the bleakness. And with more people infected, yes, more people in the hospital. Approaching 60,000 there. The average is above 50, between 50 and 60. And you can see early back in the spring, then the summer surge, 60 was the highest. We're days away, just days away from blowing past 60,000 Americans in the hospital on a daily basis from the coronavirus. And this is why the higher positivity rates, the more cases, the more people are likely to infect others. This is all across the country. 48% of the people in Iowa who get a coronavirus test come back positive. It's 54% in South Dakota. It's 34% in Wyoming. It's 39% in Idaho. Even Nevada is 12%. Anything above 5 is bad. Utah, 18%. Alabama, 20%. Pennsylvania, 16%. Florida, 7%. That's better. It's better than 50, but it's still above 5, which is where you do not want to be. And here's one of the issues from the beginning, especially with more cases now. You need more testing. Yes, this number's higher. We're averaging about 1.5 million tests a day right now, but the public health experts say we need more, many more. Listen to Dr. Anthony Fauci here. We're 8+ months into this, and
right now, what is driving the outbreak in the sense of essentially people coming in the home, small groups of people, 8, 10 people meeting together with friends for a dinner, not knowing that one of them is infected. Once you get enough testing out there in the community, you'll be able to get those people identified and get them out of circulation for the time being so they don't infect others.
With us to share his expertise and insights, Dr. Amish Adalja. He's a senior scholar at the Johns Hopkins University Center for Health Security. Dr. Adalja, it's good to see you again. Please help me on this one. We're 8+ months in, and you hear Dr. Fauci saying, when you get enough testing out in the community. Why is that still a when?
It's mind-boggling. This is an abject failure. This was the first thing we should have been doing back, not even in March, but in January, when we knew that this was going to be a problem for the United States. And we still have this same conversation over and over again that we're not testing enough, that there are testing shortages, that the turnaround time for outpatient tests is too long. And what we really need to be able to do is test ourselves at will, hopefully even someday at home, so that we can know our status, so we know, don't go to this dinner party, don't go to this restaurant, because we know at any given time if we're infectious or not. But we're still a ways away from that, and hopefully we will finally start to take this seriously, because we are really running our hospitals back into crisis, and none of us wanted to ever see that happen again.
And so a fear, I think, is shared across the public health community, is that people hear vaccine efficacy 90% coming soon, and they think, okay, great, I can let my guard down. I want you to listen to the Secretary of Health and Human Services here describing, and this is critical for people to listen to this. This will not happen overnight. There's a long rollout here, and most Americans will have to wait. Listen.
I'd be thinking in December, we would be focusing on vaccinating the most vulnerable. We'll have to look at the data and see which groups, but focused on the most vulnerable. And then by the end of January, we would have enough for all of our healthcare workers and first responders. And by the end of March to early April, we should have enough for all Americans of not just Pfizer, but of course the other vaccines in our portfolio.
That's 4 or 5 months down the line. And you know, thank goodness. Thank goodness for Operation Warp Speed. Thank goodness these drug companies, got in and they're having some success, at least in the case of Pfizer, with others to follow. But that is 4 or 5 months. What is the danger between now and then?
That people look at this as some kind of a pot of gold at the end of a rainbow, but that rainbow is farther and farther away. It's far and far away. We're going to have tens of thousands of deaths that are going to occur between now and when the vaccine is available. So we can't stop doing what we're doing just with the hope that this vaccine is going to save us, because there is a lot of time there, a lot of illness. Hospitals could go into crisis during that period of time. So we have to continue to do the social distancing, to wear the face coverings, to wash our hands a lot, worry about congregated and crowded places. We have to continue to keep that up until the vaccine is available, because if we don't do that, we will, in the interim, put our hospitals into a place where we don't want to see them, where they're rationing care.
And I want you, this is Admiral Jawar, who is the administration's testing czar. And again, the thing that has frustrated me, and I'm just a layperson, I don't have your expertise, is month after month, week after week, they talk as if this is an urgent crisis, but they've been on the job for months. Listen to his take on screening students.
Schools are opening quite successfully across the country with minimal transmission. So we do know that school testing, although it's important, very few states or districts are actually screening students. There's limited screening of staff, so that priority is probably less than we thought before. But again, we have to assess. We're at a different part of the pandemic. We'll work with the states to adapt their plans and move forward.
Is that acceptable, or do school districts need to be doing a much better job of screening students and staff?
Well, we have so far not seen major outbreaks linked to schools. We've seen it with extracurricular activities related to schools, sports, cheerleading, those types of events, but not the actual educational component. So that is one good thing. But in order to have schools open and be sustainably open and have teachers feel confident that they can teach in person, we do need to have testing in the schools, because otherwise no one is going to feel safe there, and they're going to always feel like they're dodging a bullet, especially if they're opening a school in an area where the community has a lot of spread, because the school can't help but be engulfed by what's going on in the community, because people live in that community. So I do think this is one way to move forward with schools and move forward with a whole host of activities if we have the ability, like I said earlier, just to be able to test at will. Just go and buy a test at the drugstore, keep them in your house and be able to test, or just walk up to a place and get them. We still are very far away from what South Korea could do back in February and March.
It's a sad statement. I mean, when you put that into context like that, it reminds us of the failure in the rearview mirror. Let's hope it gets better ahead of us. Dr. Adalja, as always, grateful for your insights.